Good afternoon. My name is Victoria Sadovici-Bobeica, professor assistant at the State University of Medicine and Pharmacy Nicolae Testimițeanu, and one of the reporters for the EULAR 2025 Congress. Our guest today is Professor Cosimo de Bari from the University of Edinburgh. Good afternoon, Professor, and thank you for accepting our invitation.
Thank you very much for inviting me.
Today we will be speaking about an exciting session, which is erosive hand osteoarthritis. This being a disease which is not difficult to diagnose, but it's quite difficult to treat because I think there are not so many treatment options that we have. Could you please share your insights about novel treatment in this condition?
No, that is a very important question. Thank you for asking the question. Erosive hand osteoarthritis is a type of hand osteoarthritis that is characterized by erosive damage to the joints. Now, patients with erosive hand osteoarthritis have a lot of pain and have also deformities due to the erosive damage, and these deformities can cause functional disabilities. According to the current recommendations and guidelines, the management of erosive hand osteoarthritis consists of a multidisciplinary approach with non-pharmacological interventions and pharmacological interventions. The non-pharmacological interventions include patient education, physiotherapy, exercise, while the pharmacological interventions are primarily limited to painkillers and analgesics that can be used topically or systemically. However, in the recent years there have been several studies that have looked at targeting this synovial inflammation and the subchondral bone activity to reduce pain relief and possibly halt disease progression. In particular, the methotrexate appears to be effective in patients with erosive hand osteoarthritis, and more recently the denosumab, which is a medication that is currently used in the treatment of osteoporosis and that works by blocking the resorptive activities of the osteoclasts. So I was saying the denosumab appears to be also effective, but we do need larger studies to confirm this until these medications can be part of the current armamentarium and can be also included in the recommendations and guidelines.
Yeah, that's true. And Professor, we know that you have a special interest for regenerative medicine. Could you please elaborate on that? How would this novel method of treatments, how these methods could help patients with erosive hand osteoarthritis?
No, thank you for that question. Regenerative medicine offers the exciting prospect of a possible lifelong solution by using stem and regenerative and progenitor cells, which can be derived from the same patient or from other donors. Cell-based therapies are primarily targeting knee osteoarthritis because the knee joint is a large joint and therefore is more easily accessible for intra-articular delivery compared to the small joints, such as the joints of the hands. But we still don't have high-quality evidence to support the efficacy of cell-based therapies in the context of osteoarthritis. Now, if we think about the prospects of tissue engineering, where combination of biomaterials and stem and progenitor cells can lead to the manufacturing of biological prosthesis, then an exciting prospect is the possible use of these biological prosthesis, particularly for small joints, for the more easily manufacturing compared to the large joints. So what I'm saying is that in the future we can think that maybe the biological prosthesis could be used for the small joints of the hands, but this is still in the exploratory phase, and we don't have yet any data in clinical studies. And just to conclude, I would like to highlight that in the last 10-15 years there has been accumulating evidence that there are stem and progenitor cells naturally in our synovial joints, such as the knee and possibly also the small joints of the hands. And therefore, it would be exciting to develop pharmacological interventions, drugs that can target the stem and progenitor cells that are present in the joint to enhance their intrinsic repair capacity so that this can counteract the damage that happens during osteoarthritis. But again, this is still in preclinical phase.
Yeah, so looking forward to having this treatment in our clinic maybe in 10 to 15 years.
Maybe, who knows? Thank you very much.
Thank you very much, Professor, again for sharing your thoughts about this topic. And thank you to everyone watching here from EULAR 2025 Congress. I hope that you enjoyed the Congress same as we do.